Hi, my name is Fatima Tamete. I am currently a registered nurse in Winston-Salem, North Carolina, and I am here applying to the UNCW BSN to DNP FNP program, and I'm here to answer the prompts. So for prompt one, from my understanding, both MSN and DNP programs prepare nurses for advanced practice, but the DNP goes a step further. MSN programs focus mainly on diagnosing and treating individual patients, while the DNP also prepares nurses to lead, improve quality care, and think at a population and systems level. The DMP looks at the bigger picture, how care is delivered, where gaps exist, and how we can improve outcomes for entire communities, not just one patient at a time. And that broader focus is what draws me to the DMP pathway. Prompt two. I have about 5 years of experience in healthcare, starting as a nurse tech and now a registered nurse, with experience in emergency care, progressive care, neonatal intensive care, and outpatient primary care. Working in these different areas have allowed me to care for patients across the lifespan and see how much access to consistent preventative care truly matters. Coming from Mali in Ivory Coast, West Africa, where access is limited, my experience has motivated me to further my education so I can give back to communities like the ones I come from. I want to help not only individual patients, but also address larger gaps in access to education and preventative care through the family nurse practitioner role. Prompt three. One of my greatest strengths is my ability to connect with people from different backgrounds. I come from a diverse cultural background myself, and that has made me more open, understanding, and adaptable when caring for patients. I'm multilingual and I'm very familiar with different cultural practices, which helps me build trust and communicate more effectively with patients and families. Throughout my career, from CNA to RN, I have worked with patients from all walks of life. These experiences have shaped my cultural humility and reinforced my commitment to providing patient centered care throughout the lifespan. Prompt four. A lifelong goal of mine was to become the first nurse in my family, and this goal required a lot of persistence and intentional effort from the beginning. One of the earliest challenges I had was being deferred from the nursing school, and rather than becoming discouraged, I made sure to prepare myself academically and mentally to complete the demands for the profession. Once in nursing school, I committed to completing each step of the program, maintaining my coursework, progressing through clinical rotation, and developing the skills I needed to become a compassionate and safe nurse. During this time, my mother was diagnosed with stage 4 endometrial cancer, and I became her primary caregiver while continuing my education. I required careful time management, prioritization, and emotional resistance. In my final semester, my mother passed away in an ICU, and I was given 1 week before I had to return to complete my capstone and my remaining academic and clinical requirements. Despite the emotional difficulty, I made the decision to continue and draw from strength of the long-term goal that I had. By completing each requirement of the program, I completed and graduated in 2 months after her passing. And this strengthened my resilience, deepened my empathy, and reinforced my commitment to becoming like the nurses that were there for my mom.